And welcome back to the Kiosk Presents. I'm Brian, and today we have a really important conversation to have. You know, this is a topic that is everything from the source of nervous jokes to outright terror, but here to make us feel a little bit better about it, and I can talk to it about my own personal experience as well, is Dr. Douglas Rex. He's an internationally recognized colonoscopy expert. Dr. Rex, welcome to the Kiosk Presents.
Thanks for your help, Brian.
Well, it's my pleasure to do so. Well, tell us right away, what is colorectal cancer and how can it be avoided?
Colorectal cancer is our second leading cause of cancer death in the United States. It's a cancer that starts on the inner lining of the colon or rectum, what we call the large bowel. And it typically starts off not as actually a cancerous growth, but what we call a precancerous growth, a polyp. And if we actually can identify these polyps and remove them, we can prevent people from having colorectal cancer. It's really the most preventable form of internal cancer.
Right, and I'll ask you how to maybe describe how a colonoscopy is performed, but I understand while they're doing it, they can actually remove those polyps sort of on the fly while they're just doing a simple examination, and so there's a whole lot of good that goes along with getting this done.
Yeah, that's the remarkable thing about colonoscopy, and it's the reason why it's come to dominate colorectal cancer screening in the United States. It's not the only way to get screened. Some people don't want to do it. That's what Colorectal Cancer Awareness Month is about. It's trying to get that other group that hasn't yet come around to colonoscopy to consider it. If they won't consider it, to do something like a stool test for blood that can also be useful. Not as good at detecting those precancerous lesions, but certainly better than not getting screened. If you've got symptoms like rectal bleeding, then certainly no matter what age, even any age of an adult, good to get checked. Colonoscopy usually the first test there. So this is Colorectal Cancer Awareness Month. When you turn 50, even if you don't have symptoms, it's good to get screened, and most often that's done by colonoscopy. And the great thing about colonoscopy is not only can we do a really careful inspection for these polyps, but as you said, Brian, we can remove them at the same time.
Mm-hmm. And as I kind of hinted at the beginning, when I turned 50 years old just a few years ago, I did go through that procedure. And the funniest thing, they always say that the hardest part is getting ready for it. The actual colonoscopy itself is really pretty simple and darn painless.
Everybody says that, Brian, and it's true. The procedure itself, there's really nothing to it almost all the time. But you do have to get prepared beforehand. That's something for patients to really get involved in, follow the instructions carefully, and that helps to ensure a really good examination. There's a lot to learn about. Since you've already had it, I always say to people who have to think about maybe a relative, a loved one, a friend who's not quite as engaged in their health care that you might be able to encourage to put colorectal cancer screening on their to-do list. And there's a website called crcawareness.com that we're promoting, suggesting as a great source for people to go to get a lot of information. It's got a lot of good links to other websites.
Right, and we're going to put all that information right here on the screen as well. And yeah, I would also, like I say, I'd suggest, anybody who's wary about it, just talk to somebody who's had it done. And I think that's one of the best ways that you can be reassured that it's a process worth having and it's nothing really to be afraid of. And one other thing too is this is not just a male thing or it's not just for guys. Women, men, this is an issue that everyone needs to be concerned about, yes?
Yeah, when you turn 50, whether you're male or female, this is the time to start thinking about it. If you've got a family history of colon cancer, it may be appropriate to get screened even earlier. But you're absolutely right. It affects both genders. Age is the most important risk factor. So please don't think that you're not at risk. These polyps that are present in the colon, they don't cause symptoms. And even early cancers, the ones that are most important to detect because we can cure them with surgery and other treatments, many times they don't cause symptoms. So even when you don't have symptoms, if you're of the right age group or you've got other risk factors, you're at risk. Talk to your doctor about getting screened for colorectal cancer.
Right. And please, can you give us that website address again and where people can get more information?
crcawareness.com. It's got a lot of valuable information about this topic.
Wonderful. Well, Dr. Rex, thank you so much for joining us today. We're going to make sure that we get the word out as best as we can here in Buffalo and Western New York, and we wish you the best going forward.
Thanks for your help, Brian.
Melanie, what are you doing up there?
Don, diamond engagement ring prices at the fancy stores are through the roof.
Not here at Airport Plaza Jewelers, the showroom. You don't have to pay their high prices, or worse, settle for low quality just to meet your budget.
At the showroom, we have hundreds of settings,
And thousands of GIA certified diamonds available.
all at a fraction of the fancy stores.
Wow, selection, quality, and savings at the showroom on Union, next to Subway.
Where a really great diamond doesn't cost an arm and a leg.